I'm Toby Silvertooth. I'm a nurse practitioner with CHRISTUS Trinity Clinic. This month it's on my heart to talk with you about your heart care. Heart disease remains such an important thing for us to talk about with our patients because despite all the advances we've had in medicine here lately, especially in cardiology care with invention of like the TAVR valve, we still have a poor outcome in our heart disease patients across the country. About 650,000 plus people die, which is more than any other disease process in our country from heart disease. The concerning thing about this is that a lot of heart disease is preventable a lot of the times. And in fact, when a patient comes and sees me and they don't have a known history of heart disease, that's typically what we focus on is prevention. Reducing their cholesterol, reducing their high blood pressure, focusing on their diabetes, eating habits, physical deconditioning. All these things increase the risk factor for heart disease. They're tangible and they're controllable. There's times where we can't control a patient's heart disease. Genetics is one reason. I know a guy who's in his mid-40s, triathlete, 3 heart catheterizations and 3 rounds of stents despite doing everything right. If he hadn't done that, he might not be alive. I guess it's important to me because we have control. There's some diseases out there like cancer that seem like a ghost. Patients do well, they're healthy, and then boom, cancer hits them. And the next thing you know, they've got all these processes that they can't overcome. We're still working to understand cancer a little bit better, but cardiology, for the most part, we have a good grasp on. We know what we can do to reduce the risk factors, and patients have control over that. Heart health is so important because one thing that we're looking for in life is not just quantity of life, but quality of life. And unfortunately, many times when we see these heart issues that are overlooked and not addressed by patients, they felt okay enough. They come into us whenever it's too late, and they don't feel well and they don't thrive. And all of a sudden the golden years have become not so golden. The time when we're going to be retired and enjoying life and traveling instead and spent in doctor's offices and hospitals. We have the ability to change that. We have the ability to modify these risk factors and have these patients truly enjoy their golden years like what they were hoping for.